Good afternoon. Welcome to the afternoon session. We're going to have a special symposium on the management of polycystic liver disease. And this will be followed by a roundtable discussion after several of the speakers. First of all, I would like to give a very brief introduction on polycystic liver disease and share with you some of the data we have from Toronto. So I want to just show you the burden of polycystic liver disease. This is, as Dr. Perrone had mentioned earlier, liver cysts are very common in patients with ADPKD, but most of them do not develop polycystic liver disease to the extent of becoming symptomatic. So in this study, we were interested to estimate the prevalence of clinically significant polycystic liver disease. And we use a registry that we have developed between 2003 to 2024, and in which we have followed 1,400 patients. And after excluding patients who did not have MR image that are suitable for liver volumetry, we have about 1,180 patients. And then some of them were known to have either not non-ADPKD or of unknown mutations, and then further exclusion results in about 617 patients that we know the disease is due to PKD1 or PKD2. All of these patients had been mutation characterized. Polycystic kidney disease. Yes, yes. No, they all have PKD1 or PKD2 mutations. Yeah. So this is after the, we use a segmentation program that was provided by Dr. Tim Klein. And so we were able to measure total liver volume. And this is a frequency count of the cohort that were characterized with either PKD1 or PKD2 mutations. So you can see that that basically a normal distribution with a long tail. So this is a pretty normal distribution. The normal mean volume from the population is here. And so there's a large cohort of patients that fits the normal distribution, but there's a very long tail of a patient with a large volume. So we were interested to characterize these two cohorts. And so you can see the patients that had the fairly normally distributed total liver volumes are shown here. And the male to female ratio is roughly 1, so as expected. And then these two distribution livers that are a little bit bigger than the normal, and the extreme tail that I've shown you, 44 patients. And then you see that the really significantly enlarged liver, greater than 4 liter, the female to male ratio is quite high, like it's 3 to 1, as we expect that the severe polycystic liver disease tend to predominantly affect women. We also look at the total liver volume and the age of these individuals divided by PKD1 truncating mutations shown in the gold dots, and then the non-truncating mutation shown in blue, and then PKD2 patients. And if you look at the regression line, it seemed to suggest that the patient with the PKD1 truncating mutation tend to have larger liver volume across the span of age compared to the other mutation class. So this is my brief introduction.